Amendment number one, our country it's called the Freed of Opioids Act. The country is awash in opioids, both legal and illegal. In touring Indiana, I hear from Hoosiers and law enforcement that more needs to be done to stop the opioid crisis. My bipartisan amendment would require the FDA to review a flawed clinical methodology that skews results for opioid drugs towards approval. I recognize the importance of retaining a variety of opioid painkillers on the market for those with chronic pain. This amendment does not remove any drugs from the market, but we must also ensure that the mistakes of the past do not continue unchecked into the future. Americans should have transparency for what goes into the approval of their drugs. And I ask for a roll call vote on it.
Discussion on Braun number one.
I'll go.
Senator Cassidy.
I appreciate the intent behind this, but I will oppose. The policy is duplicative of measures already included in the manager's amendment and of work that has already occurred at the Food and Drug Administration. So again, appreciating the intent, but feeling as if it's already been addressed.
Let me say a word on it. I thank Senator Braun for his amendment. This amendment would require FDA to convene an advisory meeting of outside experts to review the use of a controversial methodology used in clinical trials for opioids. Is that it? Senator Braun, is that about what it does?
Yes.
Okay. Now, according to at least one organization, the Opioid Policy Research Collaborative, quote, the FDA has been putting new painkillers on the market based on improper studies that skew results in favor of approval. The methodology they're using was cooked up in private meetings with drug makers. The time for outside experts to examine this issue is long overdue, end of quote. This amendment builds on the Support Act, which requires the FDA to study this controversial methodology and come up with a plan to review all approved opioid drugs, and I would urge a yes vote on the amendment. Further discussion?
Mr. Chairman?
Senator Casey.
Mr. Chairman, I wanted to speak on Casey number one, which will...
Okay, we stay on Braun number one. Let me see if we're any more on that. Braun one?
I just would offer that I support Braun 1 for the reasons that you've just stated. The methodology that these companies were allowed to use is deeply, deeply flawed and really fueled this epidemic.
Further discussion on Braun 1? All right, not hearing any. Senator Casey?
Thanks very much. I wanted to speak on Casey number one, which I'd be...
Oh, I'm sorry. I promised Senator Braun that he would go.
I'll be quick.
Go ahead.
Okay.
Braun Amendment number 2, the Effective Act. Last year, FDA Commissioner Califf told me that the FDA lacks the authority to deny a new opioid on the basis that the new drug is not better or safer than other comparable drugs. Opioids are a unique drug class. They are essential in treating pain, but they are also some of the most dangerous drugs available. I offer this amendment with Senator Baldwin to give FDA the authority that Dr. Califf requested. My amendment would not remove any currently available drugs from the market. When it comes to a class of drugs that has killed hundreds of thousands of Americans, FDA should have more discretion to ensure safety.
Discussion of Braun 2.
Again,
Custody.
I thank Senator Braun for, my gosh, we should all be focused on this. Thank you for being so. I support this amendment. It's a little bit different. This is a different standard, and I discussed this with my staff. We don't normally require this same, this will be an elevated requirement for a new opioid. But as I told my staff, when it comes to opioids, we have to treat them differently. When so many people are dying, it would be, naive to treat it the same way as we would treat a new statin. So I thank you for your willingness to think creatively, and I support this.
Further discussion. I also support this amendment, which would allow FDA to consider whether new opioids are safer or more effective than existing opioids when determining their approval. I think it makes sense. Further discussion of Braun 2. Senator Braun.
Final amendment number 3, Healthcare Transparency Price Act, is arguably the most important thing I think we need to discuss. I'm going to talk about it and withdraw it. I can tell you, when I tackled this same issue in my own company 15 years ago, until you get your own employees, all of us engaged as healthcare consumers, don't count on costs going down either from a government payer or through the private insurance system. When you go to the hospital, there's very little transparency on prices, leaving everyone guessing how much is it going to be when you get your bill 3 months later in the mail. There's also a lack of transparency regarding the agreements. Probably the biggest level of opaqueness in anything we do in our healthcare system between big hospitals and insurance companies. Recently, we've seen examples where huge employers have found serious disparities and wasteful practices in their own plans, and they can't get to the bottom of it. My amendment would require hospitals to publish detailed files of all negotiated rates and cash prices between plans and providers, not estimates. It also codifies the transparency in coverage rule. And the bill provides group health plans the right to access, audit, and review claims and counter data. I'll be withdrawing this amendment, as I said, but until we embrace something like this across the totality of health care, we're never going to lower costs. Thank you, Mr. Chairman.
For clarification, Senator Braun, you're withdrawing the third amendment. Do you want votes on 1 and 2?
Yes, I do.
Both of those?
Yes.
Okay.